Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good evening to everybody. Myself, I am Dr. Sabyasachi Pattanaik. I am a consultant neurologist. I am presently assistant professor in neurology in some hospital and also a consultant neurology presently practicing in Bhubaneshwar. I passed my DM neurology from Varanasi BHU and presently continuing my services in Bhubaneshwar only.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So seizure is a condition. It's a neurological condition in which, if we go to it pathophysiologically, we see that there is spontaneous firing, repeated firing of the neurons. The neurons, how they interact with each other, it is by electrical discharges. So there is usually synchronized firing of the neurons, due to which we are able to do our day-to-day daily activities and everything, and all our motor functions and our neurological functions are controlled by these discharges. Now if these discharges becomes uncontrolled, or and they fire at a massive rate, at an uncontrolled rate, then there is a condition which we usually see as seizures. So this is the cause. Now how does it manifest? It can manifest as some motor problems, like there can be certain cessation of the physical activity, there can be unconsciousness, there can be jerky movements of the body, and which can be associated with a lot other neurological conditions. Forgetfulness and developmental defects can be there subsequently. So this is what a seizure is.
What is epilepsy?
So epilepsy actually is a seizure is a part of epilepsy. So epilepsy is a syndrome, and it is defined by at least two or more unprovoked seizures. So seizures can be provoked by certain conditions, like if there is some glucose deficiency in our body, there is some infection, there is some sodium deficiency. These are triggering causes which can lead to seizures, but they will not be termed as epilepsies. Epilepsy is when the seizures are unprovoked, when there is no provoking factor, but still the patient goes on to have these seizure episodes. So that is what an epilepsy is. Epilepsy is the fourth most common neurological disease in the world, and there are a lot of people living with epilepsy. Some seek treatment, some don't seek treatment, but however there is a lot of lack of awareness about this disease, and that is the sole purpose of a doctor, is not only to treat the patient but also to educate the patient about this condition. So by this medium I would like to put forward this message also.
What are the different types of seizures and do they affect people differently?
Yes, that there are different types of seizures. Broadly, if we see the International League Against Epilepsy, it classifies seizures into three types. One is a focal onset seizure, that initially one part of the body is involved, then the entire body is involved. So it starts from one part of the body and it may spread to the other parts of the body. So that is a focal onset seizure. A generalized seizure is where the entire body entire part of the body is involved. That can be involvement of all the four limbs, the trunk, the head, everything can be involved. So that is a generalized seizure. So one is a focal seizure, another one is a generalized seizure, and the other one is a unknown onset. The patient sometimes comes to us and tells us that they don't know how the seizure has happened. So these are the three broad categories: a focal seizure, a generalized seizure, and an unknown onset seizure. Now seizures can be, as I told, that focal, and there are some specific types of seizures. Like sometimes the patient will not report that there is any abnormal movements of the body. They will just say that there was a sudden numbness and tingling sensation on the body, and it got relieved within 1 to 2 seconds. There was a feeling of fear. There was just some abdominal pain, and it just disappeared. Sometimes they will just tell that there was just a difficulty in speaking. Sometimes there will be spontaneous micturition and defecation, that is spontaneously passing the urine or the stool. So these are certain subtypes of seizures which come into the broad into under these broad categories. Broadly there are three types, but there can be multiple subtypes also into these categories.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Okay, so epilepsy, as I told you, are unprovoked seizures. But if we go into the causes of seizures, so age-wise the cause differ. If we see that a small child, less than 10 years patient in the first decade having the seizures, so it can start from some birth insult. Birth insult is when the child is born. Sometimes there is a delayed cry. There is some event during the childbirth process that can cause hypoxia, that is oxygen deficiency, and this oxygen deficiency can lead to some brain damage, and that can also lead to seizures. There can be some genetic causes. There can be some family history that can cause the seizures. And in children, the children are very much susceptible to low blood glucose level, that is hypoglycemia. Electrolytes very easily fall in them, like hypocalcemia, hyponatremia. These can be causes of seizures. And also CNS infections. Sepsis is a very common cause of seizures in very small children who present less than 1 year of age. Sometimes just fever can trigger seizures, that is called a febrile seizure. They usually stop by 6 years of age, but from 6 months to 6 years of age, that is a very common cause of seizures. Later in life, they don't affect the child. As the age of the child increases, the causes also change. Like new cause, infections are can cause seizures at any age. Brain tumors, malignancies, they can also lead to seizures. Now as we go to the adult age, we can see that there can be a few other triggers, like the patient having a stroke can have a seizure. Some people, they are habituated to alcohol, drugs. These can also lead to seizures. Excessive alcohol or sudden stoppage of alcohol, if patient is taking at a very large quantity, can also lead to seizures. Some drugs are also seizurogenic. Sometimes some medications can also trigger seizures. There is a very field of neurology, that is the autoimmune neurology, that can lead to some autoimmune neurological conditions, some autoinflammatory conditions. They can also cause seizures at the old age, primarily stroke, some neurological conditions like Alzheimer's disease. Sometimes there is multiple falls, and trauma due to those falls can also lead to seizures. So at different ages, the cause of seizure usually varies, but the treatment more or less remains the same. But sometimes the cause and the provoking agents are to be studied, because unless they are treated, the seizures won't be controlled.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
I have given just a brief overview in the previous question. So epilepsy, usually the patients, when they come, they are unconscious, or they don't have a good sense of consciousness. So the patients usually, and their parents or some relatives, they usually report that there would be posturing of the limbs, there would be some jerky movements, there would be The neck was rotated to one side. There was uprolling of the eyeballs. Sometimes the tongue gets bitten while the seizure event is happening. There can be frothing from mouth. There can be spontaneous micturition, and there can be spontaneous defecation. So these are all the common presentation. There can be some uncommon presentations also. There can be some conditions where the patient will just come and tell us that there was a feeling that there was some abnormal sensation on my body which lasted for 1 to 2 minutes, due to which during which I could not speak, I could not tell anything, I could not think about anything. I just felt fear. So these can also be some rare presentation of seizures. Another presentation of seizure is just some jerky movements. So when the patient gets up and goes to brush his or her mouth, so there will be a spontaneously the toothbrush will fall from the hands, while writing the pen will fall from the hands. So these are myoclonic jerks. It is also a type of seizure, and usually missed because they are very subtle. There can be some seizures where there will be just loss of consciousness and nothing else, and the patient will get up and they will not remember anything that has happened to them. There will be injuries on the body, and these patients are usually missed that they might be something else but not seizure. So seizure treatment is not given, but it is very necessary to know that these can also be seizures. There can be some seizures where there will be just spontaneous passing of urine, spontaneous passing of stool. There can be seizures where there will be just some behavioral changes. The patient will just run away from the house, will run here and there, beat somebody, and then in 1 to 2 minutes they will recover. So these can also be very rare manifestations of seizures, which usually the patient attendants think that they are not very important things, or they need not be dealt with, and they don't come to the doctor with those complaints. But they are also can be these can also be very can also be some rare presentations of seizures.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, in society, the patients who live with epilepsy, they face a lot of stigma. Initially, it was considered that sometimes a lot of family members think that due to the societal pressure or the study pressure, the child is behaving strangely, they are acting up, and these things they don't want to study and something, so they are doing all these activities. So that thing is there in the society, and sometimes out of shame that will these patients be accepted in the society, will they get a good job, will they have a good life, and especially in case of females, that whether the in-laws will accept them with these diseases. So these problems are rampant in the society. However, the mindset of the people should change as the awareness about epilepsy increases. We have seen some our senior neurologists, they say that there was a time when the people used to use chappals, and they used to keep it in front of the nose of the people who are having epilepsies in order to treat them. They thought that that was a treatment. So even in the treatment part also, there is a lot of stigma, and there are a lot of false beliefs that are rampant in the society. But however, the things are changing with time. Now people are more aware. They are more used to bringing their patients to the hospitals and getting them treated, and they are also maintaining the follow up period that is necessary. Another stigma or a false belief that you can say remains with the patients of epilepsy is that after taking medications for few months, when there are no episodes and the seizures are controlled, they feel that the disease has been treated, and they stop the medications, and the disease comes back with a vengeance, and the patient lands up in hospitals, not in wards but in ICUs. So that this is a big social thing that is very common. The patients should never take the decision of stopping the medications without consulting a doctor, a neurologist. They should not, without doing that, they should not stop the medications. And presently, there are also a lot of self help groups that the sometimes the government is employing, and they are also available privately, who can counsel the patients that how to live a good life with epilepsy, how to take their medications regularly, and if they are dealing with any social stigmas or any depression, that can also be dealt with by these groups also.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay. The patient and the caregiver should be our one thing that I just highlighted in the last question, that they should never stop medications without consulting a doctor. The time period of medications for different patients are different. Usually, there is a 3-year time period, but it can change from patient to patient. So they should not go by any self made guideline, or sometimes they take the opinion of other people who are unaware of how a disease should be treated, so they take the opinion of them and they stop the medication. So first things first, don't stop medicines on your own. Don't delay the timing of the medications. The timing of the medications are equally important, like the continuation of the medications. The patients and the attendants should be extra cautious when there is a fever, because fever can trigger a seizure. Even though if you are taking medications in the right amount, fever can trigger a seizure. The stress level should be lower for the patient. They should manage their stress level. They should manage their eating habits. They should take timely food. The timely sleeplessness or sleep deprivation is another trigger for the seizure, so that should not be there. The stress level should be adequately managed, and there should not be any condition where the patient is not taking the food properly. They should avoid taking any illicit drugs or any alcoholic beverages. Smoking, this should be avoided. And if these things are continuing, then there is a very high possibility that a seizure can be triggered, even though the medications are going on properly. They should be well hydrated, because dehydration is another trigger. So to remember, infection, dehydration, sleeplessness, and taking medications in time are something that the seizure patient should always keep in mind, that they should never forget those things, because they can trigger a seizure.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So during seizures, there is a common tendency that the bystanders or even the patient's attendants, they tend to hold the neck, or tend to hold the limbs when the attack is going on. So that should never be done, because that can lead to dislocation of the joints. So that should never be done. What should be done is that when the event starts, take the patient away from anything that can injure him. Like sometimes they are waiting at a bus stop, or they are waiting at a railway station, so they should not be close to that moving vehicle, because that can lead to death. And they should be taken to some place where there should be soft padding, and and possibly if there is a bed available around, or a sofa available, they should be made to lie on that. They should be kept at a lateral position, that they should be turned to one side, so that the secretions don't go into the lungs, and there is no any lung infection. And it should be tried that nothing should be given inside the mouth. Sometimes they give sharp objects inside the mouth, they can increase the risk of the injury. And we should see that if they are wearing any tight clothes, like the button is given up to the neck, or they are wearing ties, that should be removed. And the patient should be in a condition where where they should not feel suffocated. And they should be taken to an open place, where there would be open ventilation, and at least they can be properly oxygenated even during the episode. and if within 5 minutes the episode doesn't subside, so it is better to take the patient to a hospital, because at that condition, after 5 minutes, if a seizure is continuing, then it leads to a very serious condition which is called as status epilepticus. And at that time, it is not possible to manage the patient at a local place or even at home. They should be taken immediately to a hospital as soon as the 5 minutes or the 10 minutes time crosses.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So I thank you. I thank your group a lot, because through you I could be a voice to express my views and this information to the public. So just my one request is that if there is seizure, or you think there is some abnormal activity, it should be better that the patient and the attendant should consult a neurologist as soon as possible. um, a seizure, if diagnosed early and if treated early, the patient can have a very good quality of life. The do's and don'ts should be educated. The patient should be educated about the do's and don'ts, so that they can live a good life. The society should also understand that our patients cannot live with so much stigma around them freely. So the stigmas in the society should go down, and further encouragement of the awareness should increase more and more in the society, so that everybody can lead a healthy life with a good sound uh, mental health condition also, along with a well managed epilepsy. A sound mental health condition is also necessary. So the society has to also take the responsibility, and the social awareness has to increase.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.